Let me go to the phones 1 second, Dr.
Okay.
Morgan. Christine from Baltimore County, good evening.
Hi. I'm a heterosexual. I'm married, and I have a 3-year-old. And I have friends that are gay. And as far back as they can remember, they've always felt gay. And I don't feel like it's a mental disorder. I think that people are born that way. And I think that we should give them respect like we do everybody else. And I think couples should, they should have the rights. They should get better rights, like of when they need health insurance and stuff like that.
Okay. Christine, thank you. Let me get a response. Dr. Morgan?
Well, I have to say that I agree. I was very happy to stand behind Governor Glendening yesterday when he signed SB 205 into law, which was a bill guaranteeing gay people the same rights as straight people regarding employment and public accommodations. Change therapists use the pathology perspective of sexual orientation as a foundation on which to base political statements, and I frankly do not believe Mr. Cohen's statistics. They've never been published. They haven't been subject to scientific scrutiny, and frankly,
that's what Dr. Spitzer has done.
He has not published. This is not a published study.
This
is
was
a report
presented at the American Psychiatric Association, and it will be published, documenting that change is
also
possible.
at that meeting in New Orleans, we should point out that there were 2 other stuties that that refuted what Dr. Spitzer found.
Right.
So
they advertised, the advertisement for their subjects for the study said, "Help us document the damages of homophobic therapies." That's how they advertised to get their subjects. So they were looking for failures. And Spitzer didn't come in with that type of bias.
Well,
so, and also, Christine said, she said in her comment, she believes people are born this way. There's also no scientific documentation. There's a few studies that are trying to show it, but they haven't been replicated, and all those scientists said we haven't proven a thing. So I don't believe people are born this way. They have those desires for different psychological reasons.
Dr. Morgan.
It is ethical misconduct. If you were a psychologist and if you were...
I'm a psychotherapist.
Right, but you are not licensed to practice anything in Maryland. If you were, you would have to abide by the ethical standards of conduct for psychologists, which clearly state we psychologists do not discriminate against people based on their sexual orientation.
We're not discriminating.
We do not take a pathology perspective of the development of sexual orientation, which is very complex and does not...
My understanding is, based on what I've been reading, that experts think that homosexuality could be caused by a variety of factors.
Right.
Sexuality is caused by a variety of factors. We have to look at human sexuality on a continuum. There's heterosexuality, bisexuality, and homosexuality. And people do slide up and down this continuum throughout their lives, but once it's established in early childhood, it's pretty much fixed throughout lifetime.
And people can change if they want to.
Let's go back to the phones. Bob from Washington, D.C., good evening.
Hi, how are you? Thank you for having me on the show. I just wanted to say that I actually attended some ex-gay meetings and had some problems dealing with my homosexuality earlier on, and the meetings made me more miserable. They didn't help me deal with who I was as a human being, as an individual. They tried to squeeze me into this box and stick a label on me that just didn't fit who I was. And now I'm in a relationship I've been in for 4 years. I'm happy. My family knows that I'm gay, and things couldn't be more wonderful.
Okay, thank you, Bob.
I think Bob highlights the very problem with change therapies, the harm it does, and primum non nocere, a medical dictum, first do no harm. We don't harm our patients. People, the majority of people don't change. They become more depressed, they feel more guilty, more ashamed,
study shows the
and more
opposite.
alienated.
But
and my life does too.
Dr. Morgan, the majority, okay, would you agree or disagree that there could be people, there are people like Mr. Cohen,
I'm here, I'm living proof.
Who would maybe
I'm so much happier than I ever was, and the hundreds of men and women I've worked with are too. So we're just asking for our human rights. We desire the right to change.
Mr. Cohen, though, how do you react to some critics who say that this study will be used to push an anti-gay agenda?
Not. Dr. Spitzer is for homosexual rights. He's not against homosexual...
Well, we're not talking about Dr. Spitzer. We're talking about what a study like this could be used by other people.
This is science. 30 years of science, we haven't been able to study homosexuality. This is the first time in 30 years that we've had a study saying we exist. And we can change. So it's not for any political means. It's that people's hearts are screaming out for healing. And we have the right to do that. So this is a scientific study. It has nothing to do with politics. And if people want help, they can go to gaytostraight.org on the web, and they can find national therapeutic organizations and religious organizations who are reaching out to these men and women because we deserve our right to change. And I'm very happy today, and so are the men and women I know who have changed.
Dr. Morgan, we have about 15 seconds.
Okay, I can tell you I've been in a gay relationship for 24 years, raising 2 beautiful children. I am very happy too. It is possible to be gay, to be in a long-term committed relationship, to raise a family, and be effective at one's job.
I respect you for that.
Dr. Morgan, Mr. Cohen, thank you very much. Clearly this is an issue that we're not going to resolve tonight, but thank you for joining us.
Thank you, Camilla.
Again, you can go online and vote in our poll on the subject on mpt.org.